It is important that for a woman who's planning to get pregnant, especially preconception, to seek preconception counseling because there are certain things that she needs to get advice on, especially about weight, because when she gets pregnant, she actually will gain some weight. So it's important that for women who are overweight, do have a healthy plan to lose weight before they get pregnant to prevent certain conditions like diabetes in pregnancy as well as high blood pressure in pregnancy. So if you are planning to get pregnant, it's important to avoid certain foods and certain things maybe you've been doing even before you got pregnant. So one, you need to totally stop taking alcohol. Recreational drugs need to be stopped. For women who smoke, they need to stop smoking. When it comes to certain foods like seafood, we do limit seafood intake. Certain foods, seafoods like crabs or lobsters. I think shrimp and crab are not highly restricted, but there needs to be a restriction because of the content of mercury that they may have coming from the sea or from the ocean. So those may be restricted so that someone can have a healthy pregnancy and especially for the development of the baby. So the ideal BMI for any human being is between 15 and 25. But there's always an exception to a rule. So if you can be, there are those who can be slightly overweight but not obese, then that can be acceptable. But the normal BMI we expect is between 18 and 25 for a healthy pregnancy. It is important, and I'd like to emphasize this, that it is important for all women planning to get pregnant to actually seek preconception counseling from their healthcare provider. It could be a midwife, it could be a gynecologist obstetrician. And the importance of this is that you need to be started on certain nutritional supplements. One is folic acid. Research has shown over the years that folic acid is important for preventing central nervous system disorders like spina bifida as well as hydrocephalus. And it is important that a woman starts her folic acid preconception and continue up to around the 3rd month of pregnancy. The other supplements a woman may need is calcium. Research has shown for women who previously had high blood pressure in pregnancy, calcium supplementation is highly recommended to prevent pregnancy-induced hypertension. Among the Asian community, especially those who are strict vegetarians, vitamin B12 deficiency is common. So tests can be done to actually ascertain if someone has a deficiency and then they can be put on supplementation as well as vitamin D supplementation.